Welcome to today's episode of Navigating Nursing School with your nursing tutor. Today I'm going to be talking to you about endocrine disorders. Now, endocrine disorders are probably one of the most overwhelming topics that nursing students complain about and worry about and struggle with in nursing school. I'd put them up there probably with cardiac, the cardiac unit, which is a pretty big unit itself. And today, I'm going to show you how the reason why endocrine seems so difficult is simply because you don't know this one little secret. And it's really a shame, like many things in nursing school that I talk about, that you haven't been told this secret. But I'm going to tell it to you today. And understanding this, you're going to see suddenly how endocrine is actually so easy to study and to understand when you put this one little secret into practice. Then suddenly endocrine becomes one of the easier disorders or units to study in nursing school instead of one of the hardest. If you don't know who I am, my name is Nicole. I'm a professional nursing tutor with over 15 years experience, and I run the website yournursingtutor.com, where I help nursing students get through nursing school confidently and calmly. My job basically is to tutor myself out of a job. I am not just going to spoon feed you information, and you're going to see that today. I'm not just going to tell you what you need to know about endocrine disorders. I'm going to show you how to study it for yourself so that you're going to understand it and to make you the best future nurse possible, because someday you're going to have to know how to ask questions and how to figure stuff out on your own, even when you're out of nursing school. And that skill starts in nursing school. So let's talk about with endocrine. Oh, one more thing I want to tell you before we jump into it, because it's related to endocrine. I always teach things through my silver bullet study system. It's my easy 4-step method of studying. It's the best way to study in nursing school because it guides you through how to think like an experienced nurse. So the 4 steps basically mimic the way experienced nurses think, so that you can think that way too, even before you're an experienced nurse. Because obviously, you get told the advice probably, you got to think like a nurse when you study. But when you're brand new to nursing school, like, how? Okay. It's very abstract advice. I hate abstract advice because abstract advice is not helpful. It makes you feel like you're doing something wrong when you're not. You've just been given unactionable advice. So I like to give concrete advice, like step-by-step strategies for my nursing students that I tutor, so that you can actually know what to do. And so when I tutor, I always go through using the steps of the silver bullet study system because it breaks it down. Number one, believe it or not, I'm an experienced nurse, obviously. I think this way naturally and quickly. So do your instructors. Now, I have trained myself through my 15 years of tutoring experience to kind of notice how I think. This is called metacognition, right? It's like thinking about how you think. It's a lot harder to do than you believe. But it's important, I think, as a teacher and instructor and tutor, because my brain tends to jump steps. Like a quick example, think about how you drive. When you get in the car to drive, if I hand you the keys and you turn on the car, how many steps would you say that takes to turn on the car? You'd probably say, well, just one, like you just turn on the car. But if you have a brand new driver, somebody who's studying for their driver's license, and you hand them the keys and say, turn on the car, it's more than one step to them because they have to think about all the things that just come automatically to you and I because we're experienced drivers. They have to think about how to adjust their seat. Is the steering wheel in the right place? What do all the buttons and levers mean? Are the mirrors adjusted? Like, as an experienced driver, when you were told to start the car, you did those things too, but you just did them quickly and automatically and without thinking. But when you're brand new to driving, when you're not an experienced driver, those steps have to be consciously thought about. And it's the same way in nursing school with thinking like a nurse. Your instructors think this way automatically, so they take a bunch of steps and just lump them together and forget that they did them, or they don't realize that they did them. They don't realize how necessary they are. I literally had a tutoring student the other day where I was helping like diagnose a nursing school problem she was having. I was doing a tutoring assessment with her, and I said, here's your problem, is that you need to focus on this basic information. And she's like, oh, my instructors told us we didn't need to worry about that. I know what it was. She was learning about genetics and autosomal recessive disorders and sex-linked, disorders and things like that, genetic problems. And I'm like, well, do you know about Punnett square? And she's like, oh, our instructor said we don't need to worry about Punnett square. There's not going to be any questions about that on the test. Oh my goodness. Because of course there's not going to be any questions directly about Punnett square on the test. If you guys don't know what Punnett square is, you can Google it, but that's basically that old bean pod experiment that that basically demonstrated what the difference between dominant and recessive genes and the effect they have on offspring. But in order for her to understand the things that she was going to be tested on it, she had to first have a basic understanding of Punnett square and how it worked. And so once I was able to teach and explain that to her, everything else just clicked into place. And then she suddenly understood all of those PowerPoint slides her instructor had been teaching on in class. The same instructor that told her she did not need to worry about learning Punnett square. So this is why normal stuff is so important, guys. And that's step one of the Silver Bullet study system. So all that to say, that's my little soapbox before we jump into endocrine, because you have to understand the Silver Bullet study system to really effectively get through to endocrine. And I'm going to show you how to apply it today. And if you want to get I have a free 10-minute overview video that teaches the Silver Bullet study system specifically. And you can go to my website at yournursingtutor.com/SBSS. That's SBSS for Silver Bullet Study System. And just fill out your name and email address, and I will email you the 10-minute video plus a printable overview with the 4 steps that a lot of my tutoring students like to print out and keep in their textbooks to remind them when they study. So starting with step 1 of the Silver Bullet study system with endocrine, it can be kind of overwhelming because endocrine is one of those weird body systems. It doesn't feel as cut and dry as say respiratory system or cardiac system or the kidneys, renal system, because with that it's there's a body organ and then you just have to learn how it works. But with endocrine, it's kind of spread all over the body because it's anything that produces a hormone, right? And so endocrine has to do with hormones. But once you identify here's the secret. The anatomy and physiology of the endocrine system is just a chart. It's just a chart you have to memorize. I actually taught a class, every month with my group tutoring membership, I teach a bonus class that my members vote on the topic at the beginning of the month. And then, I pick usually the most popular topic. And last month it was endocrine, which is why I'm talking about it today, because it's fresh on my mind. And so I did a full bonus live tutoring class for my members. I created a chart with everything you have to memorize in order to feel confident that you know exactly what you need to know about the anatomy and physiology of endocrine, so that you can then move on to very easily understand the disorders. But in order to easily understand the disorders, the secret is you have to memorize this chart. That doesn't sound so hard, does it? You can memorize, and you know me, I hate memorization. If you hang out with me for 2 seconds. But there's a place for memorization in nursing school. The problem is that most nursing students try to memorize things you should be understanding. Well, let's be honest. You try to memorize everything. You can't. And so what I do is I teach you, these are the things you should memorize. And then once you have the correct things memorized, then you can understand the rest. You can take what you memorized and use that to understand the rest. And that's the secret key that makes endocrine so much easier to learn when you study this way. If you wanted to watch that video that I did for my members, and if you want to get the chart I made for them, it's already loaded up in my member resource library. So if you join my group tutoring membership, which you can do at my website, yournursingtutor.com, then you can get access to that today because it's already in there. I did this last month. But I'm looking at the chart I made right now. Even if you don't have my chart, I would guarantee you have a chart just like this in your med-surg textbook, okay? If you look, most med-surg textbooks, they have a chapter that kind of overviews briefly the anatomy and physiology of the unit you're about to do, and then the next chapter starts on the disease processes. So in that chapter where it's kind of giving you that normal overview, almost always there's going to be a chart that has the endocrine gland. So what body organ is it? You know, the pituitary, anterior, posterior pituitary, the adrenal cortex, the adrenal medulla, things like that, right? It's going to have a column that has all of the hormones that are produced by each of those organs. It's going to say what is the target tissue. That's just the fancy way of saying where does the hormone go to have its effect. Because here's the thing, hormones, the definition of hormones, if I didn't mention that yet, is hormones are chemical messengers that travel through the blood. So in order to be a hormone, it has to be released by one organ, an endocrine organ, and then it travels through the blood somewhere else in the body, and that's where it sends its message to a different organ, a different part of the body, to have its effect. So you want to know where the hormone starts from and where the hormone ends up, okay? And then the third column is going to be, what's the hormone do? What message is it sending? And when you have all of those three columns memorized, you are in such good shape for endocrine. Such good shape, because now it doesn't feel like such a bowl of spaghetti. Brain spaghetti is usually what I call it. You know, most nursing students, most women in general, myself included, have a serious problem with spaghetti brain, right? Where we think about one thing and that leads to another, and then next thing we know, everything's mixed up and we don't know where to start and we feel overwhelmed. Memorizing this chart prevents the overwhelm because now it's all neatly laid out. You know all the key things you need to know in order to be able to study literally any endocrine disorder. Now, in the chart that I made, I wrote it out in the way a fourth grader would understand, because not because you're dumb, but because it's easier to understand that way. So again, if you want my version of the chart, you can join my group tutoring membership. I have it in there available for my members. But I also added onto my chart. And so if you're making your own chart based on if you're not one of my group tutoring members and you're making your own chart based on your, the chart you find in your MedSurg textbook, I would recommend also adding 2 more columns at the end of that list the name of the endocrine disorder that is associated with that hormone. I did that on the chart from my tutoring members. So you do that for yourself if you're making your own. I just find that it's easier if you just memorize it at this step while you're in the memorizing mode, and then that's going to make it easier. Not every hormone has an associated disorder that you're going to need to study in nursing school. So that right there is going to make you feel better, because then you're going to be like, oh, it's not quite as much as I thought, but I can see which disorders go with which hormones. And this is why it's important, okay? You hanging with me? Because I got my slides from that class I did last month for my members. I have them open up so I can remind myself what to say on this episode. But that's step 1, is knowing what's normal. And then we're going to move to step 2, the silver bullet study system, once we have that stuff solidly memorized. Because now that we know what normal is, we just need to know what has broken or changed. And there's only 2 things. There's literally only 2 things that could break or change or go wrong when it comes to endocrine disorders. What are they? You can either have too much of the hormone, so it does its job too much, or you can have too little of the hormone, so it does its job too little. That's it. That's it. Isn't that sound a lot easier? You can have too much or too little. And now there's different things that can cause you to have too much or too little of the hormone. But honestly, we don't even care about that as much. That's good to know. There's a place for that. I put that usually in step 2B when I talk with my tutoring students. But regardless of what causes the body to produce too much of the hormone, what's going to happen next is the same, right? Regardless of what causes the body to produce too little of the hormone, the job's still not getting done. So you're going to see a lot of the same symptoms. And this is what brings us to step 3 of the silver bullet study system. So step 3 of the silver bullet study system is what happens next? What happens next? Okay? Because if we have too much of a hormone, then we expect it to do its job too much. So step 1, we memorized exactly what that hormone does and where in the body it does it. Step 2, that hormone is doing too much of its job. Step 3, we predict what's going to happen. What symptoms are we going to see? Well, what's going to happen if too much of that job is being done, right? So for example, if we are studying syndrome of inappropriate antidiuretic hormone, otherwise known as SIADH, but listen, never only memorize the abbreviation, because if you take the time to understand what the abbreviation actually stands for, it tells you, a lot of times it tells you exactly what it is. So like a lot of students will say, oh, SIADH, but then they don't know what it means. But if you stop and say syndrome of inappropriate, that means like it's there and it's not supposed to be. Antidiuretic means it's going to stop diuresis. And diuresis is peeing a lot, right? Hormone. So we're having too much of the hormone that's preventing you from peeing. Okay, and if you did your step 1 appropriately and studied your anatomy and physiology, the way that the antidiuretic hormone works is by causing the kidney tubules to reabsorb water. Okay, so it retains water, basically. It also causes vasoconstriction. Okay, so that's 2 things that the antidiuretic hormone does. Now, if we're going to be doing it that way, then what do we think is going to happen next? So if we have too much of this antidiuretic hormone that's retaining water and causing vasoconstriction, number 1, what do you think is going to happen to blood pressure? You don't have to look it up, do you? You could be riding in your car listening to this and be like, well, if we are retaining water and if we're vasoconstricting, then blood pressure would increase. And you'd be right. High blood pressure is one of the possible symptoms of syndrome of inappropriate antidiuretic hormone. Now, you're never going to forget that, are you? And not only that, but you didn't have to memorize it. You didn't have to look at a long list of overwhelming symptoms of SIADH and get the brain spaghetti trying to memorize them and figure out how they're different from all the other endocrine disorders. It just makes sense because you're connecting the dots now, because you took time, the secret, to studying endocrine, of figuring out what is the anatomy and physiology of endocrine, which is that chart. It's that chart. Now, what do you think is going to happen to the concentration of urine for somebody with SIADH? So I'm giving you a second to think about it. Because if they're retaining water, that means the kidneys are not getting rid of water, which means there's not going to be a lot of water in the urine, which means the urine is going to be highly concentrated, isn't it? You're going to have urine that is highly concentrated, which would make sense because the water's not leaving, it's staying in. Now, what would we expect for sodium levels in the blood? What do we expect with sodium levels in the blood? Would you expect sodium levels in the blood to be high or to be low? And I'm just looking at my notes and I realized I had a typo in there. I gotta go back and fix it. Because if you are retaining water, you're retaining water but not sodium. You're retaining water, which means you're going to be diluting the sodium in your blood, which means you're going to end up being at risk for hyponatremia. Hyponatremia. Because when you're taking blood levels, this is another step 1 normal thing that's related to blood tests, lab tests, and sodium and fluids and electrolytes, is that whenever you're doing a blood test like to check for sodium, it's all based on ratios. So it doesn't matter like how many total particles of sodium you have in your entire body, but it's the ratio of particles of sodium to particles of water. So if you might have, like if you could, we can't do this, but if you could count every individual molecule of sodium in your body, somebody who has SIADH might have the same number of sodium particles in their body that they did before they had SIADH, but now because they're retaining all that extra water, the ratio has been thrown off. Now there's so much more water that the ratio of sodium to water makes them have hyponatremia because there's a lot more water compared to the amount of sodium they have. This is an important fluids and electrolytes concept. So if you don't understand that, you might want to go back and listen to some of my previous episodes about fluids and electrolytes basics. But so we would expect to have hyponatremia when it comes to SIADH. Now, there's more you can do. And I always say, once you make your predictions, you have to go back and check your textbook to check your predictions, see if you missed anything. Okay? And make sure you understand and connect the dots. Because notice, all of these things we've talked about so far, they should be clear and obvious based on what we studied about normal in step 1 and what is broken or changed in step 2. So you should always be able to make those connections when you're studying this way. Now let's look at the opposite with antidiuretic hormone. So a syndrome of inappropriate antidiuretic hormone is too much of the antidiuretic hormone. When you have diabetes insipidus, that's too little of the antidiuretic hormone. It's the opposite. So guess what the symptoms are going to be? This is one of the advanced silver bullet study system techniques that I teach my tutoring students to use. So you guys are getting an extra freebie because it can cut down your study time by studying things in pairs sometimes. And this is a perfect example of when it's a really makes sense to do that, because you have too much of something, you have too little. Those are opposites. So you'd expect that at least some of the symptoms, probably most of the symptoms, are going to be opposites as well. For example, blood pressure. With SIADH, when we're retaining water, we expected the blood pressure to go high because water is being retained, blood vessels are being constricted. But with diabetes insipidus, we have too little of the antidiuretic hormone, which means we are peeing out the water. We are getting rid of water. We are not retaining it. And we are not vasoconstricting, which means they're more dilated. So what's going to happen in blood pressure? We're going to be at risk for low blood pressure now because we have less water in the body and our blood vessels are more relaxed. It's the opposite of SIADH. What about urine concentration? Again, it's going to be the opposite. For SIADH, we expected concentrated urine. Now for diabetes insipidus, remember, we're getting rid of water, which means there's going to be a lot more water in the urine. It's going to be very dilute urine. What about sodium blood levels? Well, before, remember, we were retaining water, but had the same amount of sodium. So we were diluting the sodium in the blood, which led to hyponatremia with SIADH. With diabetes insipidus, it's the opposite. We're getting rid of water, which means, but not abnormal levels of sodium. We're getting rid of the normal amount of sodium, but we're getting rid of a lot of extra water, which means that the ratio of sodium to water is going to be increasing. So now we're going to be at risk for hypernatremia with diabetes insipidus. So do you see how these symptoms are kind of opposites? And now it's a lot easier because if you get a question about either SIADH or diabetes insipidus and you can't remember exactly, you can just think about the other one and be like, well, what would happen in the other one? And then it's probably the opposite here. So it's a very good active learning strategy that also helps you to create more memory hooks. That's going to make it easier for you to understand, retain, and really get you through this information quicker and in a less overwhelming way. And then step 4, I always end up tutoring the least and spending the least amount of time tutoring step 4, because I find with my tutoring students, by the time we get to step 4, they're already like, oh yeah, I get it now. Thank you. This totally makes sense. I can see how the connections are made. See ya. I'm going to get back to studying. But step 4 is what I call finally nursing care. This is where we predict what are we going to do about it. And you basically look back at step 3, you look back at step 2, and you look back at step 1, and you connect nursing or medical care to each of those steps in a way that makes sense so that we know what to do and how to prioritize our nursing care. So if we, are expecting somebody to have high blood pressure, we're going to be monitoring their blood pressure. That would be for SIADH. Even if it's low, even if it's diabetes insipidus, we're going to be monitoring their blood pressure because we're expecting either high or low blood pressure depending on which condition they have. So we're going to be monitoring those vital signs. We're going to be monitoring their urine, aren't we? We're probably going to be measuring inputs and outputs for slightly different reasons. For SIADH, we know that they're retaining water, so we want to make sure they're not going to be retaining too much water. We might be seeing some edema and things like that if they're retaining a lot of water. Whereas with diabetes insipidus, they're going to be at risk for dehydration because they're peeing out so much more. We want to make sure they're inputting enough to compensate for that as much as possible. Okay, now, taking it back to step 2, we really need to correct the underlying hormone problem, right? So that's outside of the nursing practice specifically, but we need to know the medical care so that we can address that as nurses as well and just know what to expect kind of holistically. So if we have, for diabetes insipidus, there's not enough antidiuretic hormone, guess what? They are probably going to be getting a medication that serves as antidiuretic hormone, aren't they? And you might not know what that medication is called, but you can predict they're going to need something that replaces this hormone that they're not getting. And now you have a question that you can go into your textbook and you can look up and be like, what kind of medication they're going to get? Because I'm pretty sure they're going to need a medication for this, right? And then for the opposite, for SIADH, they're going to need something that either removes or suppresses or counteracts in some way the fact that they're having too much of the antidiuretic hormone. So maybe they get a diuretic. Maybe they would be prescribed a diuretic, or maybe they would need a surgery, because if the antidiuretic hormone, it's being produced by the pituitary gland, maybe there's a tumor that's causing that or something, a head injury, but something's going on and you might need to go in and do some surgery to remove the cause that is causing the pituitary gland to produce too much of the ADH and leading to syndrome of inappropriate antidiuretic hormone. But now you can make these predictions. You can make these predictions just off the top of your head. And then you go into your textbook and you check and you say, okay, would surgeries be done in certain situations? Would medications be given? Would I give diuretics? I thought I would. Would I? And you can look in your textbook and you can check for sure and see. And now it makes sense. And now it's not just trying to memorize a list of things that you would do without any context for when or how or what situations you would do them in. And that is going to also solve your problem of how to prioritize your nursing care, how to prioritize your answers. So those really annoying NCLEX style questions you get on your test that say, which of the following would be the priority nursing action? That's hard for you to do right now because you're just memorizing them. And when you memorize things, everything is of equal value. But now that you've attached everything and connected the dots, now you can gauge the value. Well, this would be more important to do than this because it would correct the root problem. Or this would be more important to do than that because this is an urgent thing that could go bad really quick. And this indicates that something bad's about to happen. And we need to take care of that before we can correct the root problem or something along those lines. It really depends on the scenario given to you in the test question. Using the Silver Bullet study system gives you a way to think through the process. And remember, you can get a free 10-minute overview of the Silver Bullet study system if you go to yournursingtutor.com/SBSS. Just put in your name and email and I will email it to you right away. And if you want the full training that I did for my tutoring members on how to study endocrine, then that is available in my group's tutoring membership. Right now, at the time of this recording, my group tutoring membership costs $97 a month. You get weekly group tutoring sessions, live video classroom. You also have access to post questions for me in our members only forum. You get a guaranteed answer all throughout the week in between group tutoring sessions. So you are never left on your own. You're never left to be stuck. You always have support. You always have a place to go. Plus you get my entire library of resources on things like how to use a Silver Bullet study system. I have a bunch of examples of completed Silver Bullet study system outlines that you can look at. I have dosage calculations training, test anxiety, and more. And I'm always adding things every time. Plus, you can vote on the next bonus class that I do every month for my tutoring members. So if this episode today was helpful to you, I would really, really appreciate it if you could go to Apple Podcasts for me and leave a 5-star review. It lets other students know how much you like this podcast, and it helps get the word out that not all nurses eat their young, okay? A lot of us are out here trying to change the culture, trying to make things better, trying to improve nursing education so that you can have a better experience than we did, and that the next generation of nurses that come after you will have an even better experience than you did. So I would really appreciate that. And until next time, good luck on your nursing school journey.